There are safety protocols for you I almost said HR, but then we know HR isn't our friend. I'm going off on a tangent. Let me get right back into it. Have you ever heard about the pause checklist timeout protocol that is implemented in nearly every single hospital before a surgery, before a procedure, worldwide? Have you heard about that? Well, if that was in place, I believe that the unfortunate circumstances that happened to Mr. Willie King, age 51 at the time, would not have occurred. In May of 1995, at a community hospital in Florida, Mr. Willie King went in to have surgery by Dr. Sanchez. Many errors occurred, which resulted in Mr. King's wrong leg being amputated. After that error was discovered halfway through surgery by a nurse who brought it up, Dr. Sanchez said, "It's too late. I'm already there." He had to finish that amputation. And then at another date, Mr. King had to go back and have the correct leg amputated, which was his right leg. How in the world did this happen? And is there anything in place that stops this kind of thing from happening? You know, I've talked a lot about medication errors. Well, errors in medicine occur for a variety of reasons. There are a lot of moving parts and a lot of people are touching the situation, whether it's, you know, pharmacy and medication and doctor's orders and misinterpreting orders for a medication and the nurse pulling up a medication that sounds and looks like the same one or overriding it from the Pyxis. There are just so many factors that can occur. And that's just one medication, like a medication situation I'm talking about. There's also been an awful lot in the past where people are afraid to speak up. They're afraid to speak up to a surgeon, to an ER doctor, to that orthopedic physician. They're afraid of their boss. They're afraid of retaliation. They're afraid of embarrassment. They're afraid, what if I'm wrong? I think that this is wrong, but I better not speak up because, you know, what if I said something wrong and then I really angered the doctor? I'm definitely not giving excuses. There's no excuse. What I'm just saying is that it can be very complex as to why a double check system wasn't done, or why somebody couldn't read the order correctly, or why the doctor wrote the order incorrectly, or there's just so many issues. But I'm going to focus on this one here. Mr. Willie King, like I said, age 51, has diabetic complications and problems with his limbs. So his right foot was to be amputated. And it's not just the foot. I mean, it's going to be below the knee. So that would be lower leg. And that was needed due to his perhaps diabetic neuropathy. Maybe he had infections. I don't know the details of that part. There were a lot of things that did not happen when he went to surgery that occur now if he would have, you know, it's scheduled today in this time frame. Many errors like this were happening, and people thought, you know, how can we reduce these significant errors? Because oftentimes when a surgeon or healthcare provider makes an error, it's catastrophic, perhaps, you know, compared to maybe a teacher or compared to somebody else. The occupation of that surgeon making a mistake or that team making a mistake can be catastrophic, life-threatening, can cause complications for the rest of a patient's life, like in Mr. King's, and can result in a hospital getting sued, a physician getting sued. University Community Hospital was sued, and so was Dr. Sanchez, Rolando Sanchez. The patient, Mr. Willie King, received $1 million. Do you think that's enough? I don't think that's enough. $1 million to have now both your legs amputated? Come on. And I believe Dr. Sanchez was suspended for a few years. This checklist or timeout process or pause, like I said, is now worldwide. If it isn't, it should be in every single hospital. I live here in the United States. It's done here. This started many years ago when teams were trying to figure out how can we stop this from happening. And different complications like Mr. King's would keep occurring, and this is what was formulated. Now this has different names. Like I said, sometimes you'll hear people say time out, we're going to take a pause, and that means that they're going to go over a checklist whether you're in an interventional radiology department getting something done, whether you're going back for surgery, in surgery before the surgery begins, or whether you're having a different type of procedure done. It's not just, this kind of protocol is not just done in hospitals and clinics. It is also done in the military for IT purposes. I had to refer to my list, but aviation uses it as well. They use their checklist and their timeout. That's all I'm going to say there. And even businesses such as event management, because it's important that each step is done and done correctly. And it's not just one person looking at the checklist, it's a team looking at the checklist. So let's talk about what happened in Mr. King's case that led to the wrong leg being amputated. We're going to start with, not necessarily in this order, but communication. Have you ever gone back to surgery and you never saw your surgeon before you went back? And of course, you didn't see your surgeon while you're in there before anesthesia puts you under. And then when you wake up, you still never see your surgeon or talk to your surgeon until maybe your follow-up, if you get one. I have been in that situation. I wonder, I hope it was my surgeon. I don't know who was back there because she never came to speak with me. That used to be the old way, and it's not supposed to be like that anymore. The requirement is that the surgeon, just like we see anesthesia and we see the nurse, come and speak with the patient or the patient's family. And when I say or, if I'm referring to maybe an elderly person who can't understand what's going on, or somebody with a medical problem, or a child. That's when the family, it's not that you speak to the family instead of the patient, it's that you speak to the family with the patient. Communication wasn't done in Mr. King's case, so the surgeon didn't come speak to him beforehand. When it came to Mr. King signing his consent form, the physician didn't look at the consent form and see that the correct leg was documented. The other thing that wasn't done is, have you ever had surgery and the physician says, mark the site, put an X. And then the surgeon will put the initials or an X or a line or mark things all over the place that are marked up. But that's really critically important. And one thing I want to say is that I've had patients say to me, you know, you guys keep asking me over and over what surgery I'm having. Do they not know what I'm having? So patients think that because they have to repeat it or mark it, that it's because they're teaching the staff what to do, that they don't know. It's that they want to make sure you know. It's that everybody's on the same page before operations begin. They want to make sure that you fully understand that it is your left leg, that they're doing surgery on. You're marking it, the surgeon's marking it. It's on your paperwork that you're going to sign. But none of that happened with Mr. King. So let's go back a little bit further. When he had his history and physical, the surgeon did document the correct leg. He needs to have the right leg amputated or right foot amputated. But then when the surgery scheduler got a hold of everything and said, okay, you know, I'm scheduling your surgery for May. In 1995, it was in May. I'm going to schedule your surgery in May, Mr. King. And she put the wrong leg in. So she said left amputation. Not right. There's another error. When you go in for surgery or when you're in the ER or even on the floor, there's a board. And the board often, not every place has them anymore because of HIPAA, or it's up, things are changed. It's not the patient's name that's up there anymore with their date of birth and what room and so forth. But there is a surgical board that said that Mr. King was going back for surgery on this date at this time in this operating room, and it listed the wrong leg. Then when he got back for surgery, the surgical team, not surgeon, prepped the wrong leg. Then when Dr. Sanchez came in to do surgery, he visually looked down, saw that it was prepped, didn't know it was the wrong leg, and then began doing surgery because he saw that that leg also had some problems. So you can see how one error trickles down to many, and that this person didn't double check this kind of thing, you know, and I think that, you know, that's why errors still occur. It's just people are human. Whose responsibility is it? It's not just one person's responsibility. And also I'm going to probably upset people, but I'm going to include the patient in here. You are your best advocate. You still need to know which part of your body you're having surgery on. These things just happen. I'm not blaming and not excusing. I'm saying it's a team effort. Be your own advocate. Please, please Ask all the questions before you go back for surgery, before that procedure in radiology, or whatever it is that you're going to go have done. And in Mr. King's case, it seems there was no opportunity for him to ask any questions because nobody came to speak with him. The biggest, most important person, the surgeon taking off his leg, didn't come back to speak to him before surgery, so they both could mark the spot and they both could go over it. Because when Mr. King woke up from surgery and was in recovery, that was apparently the first thing that he said is, no, it was the wrong leg. This is the wrong leg. He knew right away. So let's talk about what a root cause analysis is. When problems occur in hospitals, just in case people don't know, and other places, this is just not a hospital, but I'm speaking about this case. When something really terrible happens, minor or major, there are a team of people that get together and scrutinize this and figure out what in the world happened, why. There are different types of root cause analysis systems, like the 5 whys, asking 5 times why, breaking it down. There's different types, and then also some places can hire out where there's people that come and do your root cause analysis for you and figure out what went wrong and how it could be corrected. So here is Mr. King's root cause analysis. And I'm going to go over with you all of the things that they list as what went wrong that resulted in this problem for him. And then I want to talk to you about what is exactly in the checklist for universally for hospitals. And that real quick, it's required that people speak up, and it is illegal for retaliation to occur. Now, I'm not saying it doesn't, and I'm not saying they're still afraid to speak up, and I understand that. But it is critical that people speak up. It is required. In some states, it is absolutely the law that you are to speak up and not be afraid of retaliation and not be afraid of that surgeon. I know I've been afraid of doctors before. I remember in the ER, a pediatric ER with a doctor, his name's Dr. Hurt. Anyway, I hadn't been trained yet. Story time real quick. I hadn't been trained yet on the phone, the system where the paramedics and EMT are out there in the field and they're calling in. It was like we had a red phone and some other phone systems. And so I hadn't been trained on that. Now, it would be just like, you're not going to go work in a place where you're answering, hello, pediatric ER. I have no idea what you should be giving. I don't know. I'm not sure where the doctor is. No, you want somebody who's seasoned, been trained on it. There is a protocol for that too. So I hadn't had any of that information given to me yet. I'd only worked there a couple months and the phone went off and I was looking around. Now the doctor answers it, but Dr. Hurt didn't answer it. He just sat there. And so I spoke up and told him, I'm sorry, I haven't been trained on the phone yet. Could you please answer the phone? And he went over and answered the phone, and then he came back to me absolutely furious. So that was the time when I felt my heart beating so hard that I thought for sure that everybody could see it, because he was in my face and yelling and mad and angry and spitting and furious with me, and my heart was beating so hard because he was that mad that he had to answer the phone. All right, now, would that hinder me from speaking up to him in the future? Absolutely. Would it hinder me, a nurse, from speaking up to anybody when I didn't know something fully? I'd be too afraid to say I'm not really sure how to do something. That's the kind of things that would happen, and that breeds fear, and that breeds fear. So I fully understand people out there saying, yeah, well, in my hospital, we don't speak up. I totally get it. But things are changing. You have to speak up. We all have to speak up. There are safety protocols for you I almost said HR, but then we know HR isn't our friend. I'm going off on a tangent. Let me get right back into it. The Willie King case, wrong foot amputation analysis. Let's go. As stated before, much of the paperwork listed the wrong foot. Operating room scheduler listed the wrong foot. Scheduler incorrectly listed the wrong foot. So operating room scheduler and scheduler to have surgery done both listed the wrong foot. Therefore, the wrong foot was prepped. The surgeon never came and spoke. There was no communication to that patient. There was no marking of the site by the surgeon or the patient. At that time, the surgeon was not required to check the paperwork. Nobody checked the paperwork. The board, the blackboard, the main board listing surgeries either in that operating room or in the department listed the wrong foot. As stated, wrong leg was prepped for surgery. Surgeon looked at it and thought that was the correct leg just based on how not well that one looked. Didn't ask any questions further. The good foot, so to speak, looked like it needed to be amputated too, according to the team, or the surgeon, according to the surgeon. In the history and physical listed the correct leg. In this root cause analysis, it is not the 5 whys they used, it's the problem analysis and solutions. So what were the solutions for this case? What's the reason for a timeout protocol or making new solutions? The timeout protocols are a simple yet powerful intervention to improve patient safety and surgical outcomes. The goal of the protocol is this: to prevent errors caused by rushing or by assumptions. Cutting corners, fostering clear communication is a goal. Teamwork among surgical staff is a goal. Make sure everything is in place with the correct patient, the correct site, and the correct procedure. In addition, a lot of this, the checklists also discuss making sure that the proper equipment is available and ready to go in the operating room. The long-term changes that this particular hospital made after Mr. King to reduce future wrong site surgery, they implemented a double backup identification system, a computerized error tracking system, and adding patient safety officers throughout the facility. The state in which this incident occurred, Florida, now requires the surgeons meet the entire surgical team and verify they are performing the correct surgery on the correct patient on the correct site, as well as communicating with the patient beforehand and marking the site. Since the safety checklists and timeouts, pauses have been implemented, studies have been performed, and there is a significant reduction in medical errors, wrong site surgery errors, deaths, and litigations. So in other words, it's working. It's not 100%, but it's working. And if everybody just comes together with better communication, the expectations are high on with every single person on the team, including the family and the patient. I will see you at the next video, which is going to be really interesting, about a lady named Regina Turner who was scheduled to have a craniotomy on one side of her head and they accidentally did it on the other side. So let's talk about that interesting case and what happened out of that. So hopefully this was helpful and interesting. And if you like content like this, medical mishaps, myths and facts, please consider subscribing and consider sharing. And please click the like button, because we're never seen out here unless people continue to join and continue to click that they like this content. Remember that subscribing is free. It doesn't do anything at all but create a person that makes videos to be seen a little bit better. So please consider subscribing. I will see you at the next video, which is going to be really interesting, about a lady named Regina Turner who was scheduled to have a craniotomy on one side of her head and they accidentally did it on the other side. So let's talk about that interesting case and what happened out of that.